Why do fibromyalgia patients experience muscle stiffness? Have you ever wondered why people with fibromyalgia often feel muscle stiffness? This is a common symptom, and understanding it can help shed light on the condition itself. Fibromyalgia is characterized by chronic widespread pain, fatigue, and stiffness, particularly in muscles and deep tissues. Unlike inflammatory muscle diseases, fibromyalgia does not involve classic inflammation or muscle damage. Instead, it involves abnormal pain processing and changes in muscle tissue. One key reason for muscle stiffness in fibromyalgia is increased muscle pressure and tension. Research indicates that the pressure inside the muscles of fibromyalgia patients can be significantly higher than in those without the condition. This elevated pressure compresses small blood vessels, reducing blood flow and oxygen delivery to the muscles. When muscles do not receive enough oxygen, it can lead to pain and stiffness. This increased muscle tension may also contribute to postural changes, such as a straightened cervical spine curve due to tightness around the neck. Another factor is muscle hypoxia, which refers to oxygen deprivation in the muscles. When muscles lack adequate oxygen, it triggers metabolic disturbances that can sensitize pain receptors in the surrounding tissues. While muscle fibers themselves do not have pain receptors, the tissues around them do. When these tissues become sensitized due to hypoxia and metabolic byproducts, it can contribute to the sensations of stiffness and pain. Central sensitization is another important aspect of fibromyalgia. This means that the central nervous system, which includes the brain and spinal cord, processes pain signals abnormally. This heightened sensitivity amplifies pain perception even with minimal or normal sensory input from the muscles. Persistent pain signals from the muscles and other tissues keep this heightened pain state going. Central sensitization can also lead to increased muscle tone and reflexive muscle guarding, which contributes to the feeling of stiffness. Emerging research suggests that neurogenic inflammation may also play a role. This refers to the activation of immune and inflammatory pathways in both peripheral tissues and the nervous system. The releases of inflammatory molecules can increase the sensitivity of peripheral nerves, worsening muscle stiffness and pain. In summary, muscle stiffness in fibromyalgia arises from a complex interplay of factors. Increased muscle pressure leads to oxygen deprivation and metabolic changes, while altered pain processing in the nervous system amplifies discomfort. This understanding emphasizes that muscle stiffness is not due to classic inflammation or muscle damage but results from changes in muscle physiology and nervous system function. For those living with fibromyalgia, therapies aimed at improving blood flow to the muscles, reducing tension, and addressing central sensitization can be beneficial. These may include exercise, cognitive behavioral therapy, and appropriate medications. However, it is essential to consult healthcare professionals for personalized treatment plans. Understanding the reasons behind muscle stiffness can empower patients to seek effective strategies for managing their symptoms.